What if the technique you've used for 40 years is now silently working against your health? Most older men never get taught how to adapt. They just continue doing what always felt familiar, faster, firmer, focused only on the end goal. But after 60, your body changes, and if you don't change with it, what once felt good can now lead to discomfort, frustration, and even long-term harm, because the truth is, the wrong technique can quietly damage your circulation, reduce nerve sensitivity, and affect your confidence more than you realize. Today we're going to fix that. I'm Dr. Thomas, a board-certified urologist who spent the last 22 years supporting men over 60 in maintaining healthy, confident, and safe sexual lives with clarity and compassion. And in this video, I'll walk you through how to adapt your self-touch routine in a way that protects your body, respects its changes, and supports your pleasure and health for years to come. First, let's start with what's changed, because many men feel surprised, confused, or even ashamed when their bodies no longer respond the way they used to. But let me reassure you, this isn't dysfunction. This is biology. As we age, several systems that affect sexual response begin to shift. Testosterone, the hormone responsible for libido, mood, and performance, begins to decline. That doesn't mean desire disappears completely, but it often becomes less spontaneous. Blood flow also changes. The small vessels that supply the penis can become less elastic and less efficient, making erections slower to build and more difficult to maintain, especially when you're alone and relaxed. And then there's the nervous system. Nerve endings that once reacted instantly can become a bit quieter. Touch may feel more muted. Sensations may take longer to process. So what does this mean for you? It means that the methods you relied on in your 20s, 30s, and even 50s, the habits built over decades, may no longer serve your body, and that's not your fault. It just means it's time to update your technique. Unfortunately, many older men never realize this. They assume something is wrong with them, or worse, they push harder, they tighten their grip, increase the speed, and focus entirely on climax, thinking that will somehow bring the feeling back. But these habits, fast, firm, outcome-driven, are actually working against your body after 60. So let's talk about the 5 silent mistakes I see most often in older men's routines and how to avoid them. Mistake number 1. Using the same grip strength you've always used. After 60, the skin of the penis becomes thinner and more sensitive to friction. What used to feel pleasurable might now feel slightly irritating or even painful. A strong grip can damage small blood vessels, desensitize nerve endings, and reduce your body's ability to respond. The fix: loosen your grip. Experiment with a gentler hold. Your goal isn't force, it's sensation. Mistake number 2, going too fast too soon. When your nervous system slows down, fast motion can actually overwhelm it. The brain doesn't register the signal fast enough, so pleasure can feel flat or confusing. Think of your body like a radio tuned to a slightly different frequency. The music is still there, but the tuning needs to be more precise, slower, steady. Rhythmic movements allow your brain to process the sensations more fully. Mistake number 3, skipping lubrication. Many men think lubricant is only for partnered sex or only for women. That's not true. As testosterone drops, natural lubrication decreases even in men. Combine that with thinner skin and dry stimulation becomes risky. It increases friction, which can cause micro tears, rashes, or delayed soreness. The solution is simple. Apply a gentle, unscented, water-based lubricant early before you feel fully aroused. This allows your skin to soften and respond and helps your nervous system interpret the touch as pleasurable instead of stressful. Mistake number 4, forcing yourself to climax. Climax is not the measure of a successful experience. Especially after 60, your body may take longer. Your arousal may come in waves, and that's not a failure. It's a new rhythm. The harder you try to achieve pleasure, the more likely you are to activate stress hormones that actually suppress it, Let your experience unfold. If you feel satisfied before climax, that's valid. If you pause and return later, that's fine. Let go of the stopwatch. Right mistake number 5, ignoring your body signals. After decades of routine, it's easy to go on autopilot, but self-touch after 60 is less about repetition and more about response. If something feels dull, adjust. If something feels uncomfortable, stop. If something feels unexpectedly good, stay with it. You're not performing, you're connecting. So what does an adapted, healthier self-touch technique actually look like after 60? Let me walk you through it, step by step. First, choose your moment carefully. Don't rush. Block out at least 15 to 20 minutes where you won't be interrupted. You want your nervous system to feel safe, not on alert. Second, set the environment. Dim lighting, soft background music, or even warm lighting can signal your brain to relax. Comfort is the foundation of pleasure. Third, start with your breath before touching anything. Take 5 slow, deep breaths in through the nose, out through the mouth. This tells your body, I'm safe, I'm present, I'm not in a rush. Fourth, apply lubricant early, not as an afterthought, but as the first invitation. Gently rub it across your entire genital area. Let the warmth, moisture, and touch become part of the process, not just a setup. Fifth, explore slowly. Don't go straight to the most sensitive areas. Think of this as a massage, not a machine. Explore pressure, temperature, even different hand angles or rhythms. Sixth, pause when needed. If arousal fades, that's okay. It may return or not. The goal isn't to reach a finish line. The goal is to experience connection. And seventh, breathe throughout. Breath is your best tool for keeping blood flowing, staying relaxed, and tuning into sensation. This might feel unfamiliar at first, but for many men, this kind of approach opens the door to deeper satisfaction than they've felt in years. Now let's talk about how your position affects your experience, something many older men overlook. If you're seated on a hard chair or hunched forward, you may be compressing pelvic nerves or blocking blood flow. Try reclining with support behind your back, lying on your side, elevating your legs slightly with a pillow. You may be surprised how much better things feel just by shifting your posture. Some men even benefit from soft aids like warming sleeves or textured tools designed to provide sensation without force. These aren't toys. These are tools, just like glasses or hearing aids designed to support your changing body. The point here is simple. Your body deserves adaptation, not judgment. Your technique deserves evolution, not repetition. You're not broken. You're just in a new phase, and that phase deserves guidance. Let's shift now to something that often gets ignored, but is just as important as technique: your mindset, your mental space, and the emotional side of self-care. You see, after 60, self-touch is no longer just about stimulation. It's about creating a space where your mind, your body, and your nervous system can reconnect without pressure, without guilt, and without shame. Too many men still carry silent expectations that it has to look a certain way, that it has to end a certain way, that if it doesn't feel like it used to, something must be wrong. But the truth is, what you're experiencing isn't failure. It's a different kind of pleasure, slower, softer, and more responsive to presence than performance. Take your time. Let the experience unfold like a slow wave, not a spark. If you feel tension building, pause. If you feel distracted, breathe. If you feel satisfied before climax, allow that to be enough. This is not a race. It's not a test. It's not a performance. This is you tuning back into your body's language, and with time, you'll find that what your body is saying now is different than what it used to say, but no less worthy of listening to. Now let's talk about when you should consider speaking to a doctor. Because while many of the changes you're experiencing are natural, some can be signs that your body needs support, and knowing the difference is how you take care of yourself, not how you judge yourself. Here are 4 clear signs that it may be time to check in with a urologist. 1. Persistent pain or discomfort during or after self-touch. A mild sting, dryness, or burning, feeling that doesn't improve with lubricant or gentler technique could signal. Inflammation, minor infection, or tissue irritation. These are common and treatable, but left unaddressed. They can worsen over time, too sudden or ongoing numbness. A gradual decrease in sensation is common with age, but a sharp drop or dead zone of feeling may reflect a nerve-related issue that needs to be evaluated early. The earlier it's caught, the better the outcome. 3. Inability to get or maintain an erection, even in calm, private settings. If arousal used to be possible and now feels impossible, despite privacy, comfort, and rest, this may signal a blood flow or hormonal issue. This is not a reflection of your masculinity. It's a vascular system, and it may need attention. 4. Emotional distress linked to self-care. If you're feeling anxious, ashamed, frustrated, or disconnected during or after self-touch, don't ignore it. Emotional health and sexual function are deeply connected. Talking to a doctor isn't a sign of weakness. It's a sign of commitment to your own well-being, and you don't need to wait for something to go wrong. Even a 30-minute check-in with a urologist can give you clarity, relief, and practical next steps. If you're unsure how to start the conversation, try something simple, like I've noticed some changes in how my body responds during solo activity. Is this part of normal aging, or something I should keep an eye on? You can also mention specific symptoms like dryness, sensitivity, loss, or blood flow concerns. Most experienced providers will know exactly what you mean and respond with the respect you deserve. So let's bring this all together. After 60, masturbation, or what I prefer to call intentional self-touch, is not about going back to what once was. It's about moving forward with awareness. It's about discovering what still works, what still feels good, and what still connects you to yourself. It's about loosening your grip both physically and mentally, slowing your pace, listening to your body instead of pushing it, letting go of outdated definitions of success, because pleasure after 60 is not just possible. It can be more grounded, more mindful, and more meaningful than ever before. Your body is not broken, it's evolving, and you deserve to evolve with it, not against it. If this video helped clarify how to care for yourself more safely and respectfully, then what I'm about to say next is even more important. Even with the right technique, there's one habit that silently affects your prostate health, especially if you masturbate regularly. Most men don't realize it until it's too late. So before you close this tab, I urge you to keep watching. In the next video, I explain what every older man needs to know about how self-touch affects the prostate and what to do instead. Click here to watch if you're older and masturbate. I urge you to watch this video because taking care of yourself means staying informed and staying ahead.